Opioid-related medical emergencies happen when there's too much of an opioid in the body, or drugs are laced with an opioid and a person stops breathing properly. Breathing is critical because the brain can be damaged in just 3 to 5 minutes without oxygen. Fortunately, many opioid overdoses progress slowly, allowing time to intervene and support the person. Recognizing an overdose is the first step. Signs can look different depending on the person. Skin tone may affect how signs of overdose appear. For individuals with darker skin tones, lips or fingertips may turn gray or purple. For lighter skin tones, they may appear blue or purple. If you notice 2 or more of these signs, it's a medical emergency. If safe and appropriate, call 911 or the local emergency number. Very small, pinpoint pupils that don't respond to light, pale, cold, or clammy skin, slow, irregular, or no breathing, sometimes with gurgling, snoring, or choking sounds, limp body, vomiting, unconsciousness or weak pulse, unresponsiveness, confusion, or slurred speech. Use the Save Me steps to respond. S. Stimulate. Try to wake the person. Call their name, speak loudly, pinch the shoulder muscles tightly. A. Airway. Lay them flat on their back if safe. Open their airway and check for obstructions. Assess breathing for 5 to 10 seconds. V. Ventilate. If you detect noisy gurgling or very slow or absent breathing, give 5 rescue breaths if you have a face barrier in your Naloxone kit. Tilt the person's head back, lift the chin, pinch the nose, and breathe into the person's mouth once every 5 seconds, 5 breaths in total. You should be able to see the person's chest rise up and down. After delivering 5 full breaths, reassess the person's breathing and overall condition. E. Evaluate. Evaluate the person requiring support to determine whether the rescue breathing is helping. If there is no breathing or breathing continues to be shallow, you will administer Naloxone. M. Medication. Peel the package, place the nozzle in one nostril, and press the plunger to deliver the medication and count to 3. Then continue rescue breathing every 5 seconds for 2 to 3 minutes until the medication takes effect. Naloxone takes approximately 2 to 3 minutes to take effect, depending on the body composition of the person and the drugs present in their body. If you don't see any improvements after 2 to 3 minutes, give another dose as needed. Between doses, keep providing rescue breaths to ensure oxygen reaches the person's brain. If the person is not breathing at all, perform CPR if you are trained and able. Start with 30 chest compressions, followed by 2 rescue breaths, and continue this cycle for 2 to 3 minutes until help arrives. E. Evaluate again. Check for improvement. If they start breathing, place them in the recovery position and continue to monitor them. Naloxone lasts 20 to 40 minutes, after which the signs and symptoms of an opioid overdose might come back. So, stay with the person until help arrives. If the person wakes up, they may feel confused, scared, or experience withdrawal. Speak calmly and respectfully. Give them space and reassure them. Remember that time matters. Recognize early signs. Follow Save Me. Give rescue breaths first if you have a face barrier, then administer Naloxone. Stay with them until help arrives. Acting quickly can save lives in your community.